Your kidneys are bean-shaped organs located just below your rib cage, one on each side of your spine. Don't let their small size fool you. These organs are vital for keeping you alive. They act like your body's filtration system, removing waste products from your blood and flushing them out as urine. Without kidneys, waste products and excess fluid would build up in your body, leading to serious health problems. It's like having a clogged drain in your house. Eventually, it leads to a big mess. That's why it's crucial to keep your kidneys healthy and functioning properly. Think of your kidneys as hard-working housekeepers, diligently cleaning your blood 24/7. They filter about 150 quarts of blood every day, ensuring that your body runs smoothly and efficiently. In the next section, we'll delve deeper into the intricate world of nephrons, the tiny heroes responsible for this incredible feat. The process of blood filtration in your kidneys is a marvel of biological engineering. It involves a series of steps that ensure only waste products are removed, while essential substances are retained. Blood enters the kidneys through the renal artery, which branches into smaller and smaller blood vessels until it reaches the glomerulus within each nephron. The glomerulus's sieve-like structure allows certain components of the blood to pass through and enter the tubule. As the filtered fluid, now called filtrate, travels through the tubule, essential substances like water, glucose, and electrolytes are reabsorbed back into the bloodstream. This reabsorption process is highly selective, ensuring that your body retains the nutrients it needs. Meanwhile, waste products like urea, creatinine, and excess water remain in the tubule and are eventually excreted as urine. The urine then travels down the ureters to the bladder, where it is stored until it is eliminated from the body. Section 4. Beyond filtration. The kidney's multifaceted role. While filtering waste products is undoubtedly their most critical function, your kidneys wear many hats. They are involved in several other essential bodily processes that are crucial for maintaining overall health and well-being. For instance, your kidneys play a vital role in regulating blood pressure. They do this by controlling the volume of fluid in your body and producing an enzyme called renin, which helps regulate blood pressure. Furthermore, your kidneys produce a hormone called erythropoietin, which stimulates the production of red blood cells in your bone marrow. Red blood cells are essential for carrying oxygen throughout your body, making erythropoietin crucial for preventing anemia. Additionally, your kidneys help maintain healthy bones by converting vitamin D into its active form, which is essential for calcium absorption. Calcium, as you know, is vital for strong bones and teeth. Section 5. When kidneys falter. Understanding kidney failure. When your kidneys are damaged and can no longer perform their functions properly, it is known as kidney failure. Kidney failure can be acute, meaning it develops suddenly, or chronic, meaning it develops gradually over time. Acute kidney failure can occur due to various factors, including severe dehydration, infections, certain medications, or a sudden blockage in the urinary tract. Chronic kidney failure, on the other hand, is often caused by long-term conditions like diabetes, high blood pressure, or autoimmune diseases. Symptoms of kidney failure may include fatigue, swelling in the legs, ankles, or feet, decreased urination, loss of appetite, nausea, and vomiting. If left untreated, kidney failure can lead to serious complications, including heart disease, stroke, anemia, and even death. Treatment for kidney failure depends on the underlying cause and the severity of the condition. Options may include medications, lifestyle changes, dialysis, or in some cases, a kidney transplant. Section 6. Keeping your kidneys healthy. Tips for a lifetime. Your kidneys are resilient organs, but they are not invincible. Stay hydrated, manage blood pressure and blood sugar, maintain a healthy weight, and be mindful of medication use. Early detection is key to preventing kidney disease from progressing. Make healthy choices to keep your kidneys functioning optimally.